Morning. I'm going to take about the epidemiology of diarrheal diseases. So moving on to the next slide. So this will be the outline of my presentation. First, I will be dealing about the introduction, then about the disease burden, that is epidemiology aspect, the public health significance. Then I will be moving on to the epidemiological triad, followed by the modes of transmission, then the control of diarrheal diseases, the treatment, and then I will be dealing about the health programs for pertaining to diarrheal diseases. Okay. First, moving on to the introduction. So moving on to the introduction part, it is defined as a passage of 3 or more times loose or liquid stools per day. Okay. So previously, there is also another definition for this: a recent change in the consistency and character of the stool than the number. Okay. So it is not the number. Okay, but it is the consistency and character of the stool that matters when it comes to the definition of diarrhea. So there are clinically 4 different types of diarrhea. So acute watery diarrhea, acute bloody diarrhea, persistent diarrhea, and diarrhea with severe malnutrition. So acute watery diarrhea. So up to differentiate these four is acute watery diarrhea. It usually occurs for hours to days. Okay. So usually Vibrio cholerae, E. coli, rotavirus, those things, the common things like food poisoning, we use the term food poisoning, right? So that under comes under acute watery diarrhea. The next thing is acute bloody diarrhea. The most common cause for acute bloody diarrhea is Shigella. Okay. And the persistent diarrhea. Persistent diarrhea, it is a diarrhea which is occurring for more than 14 days. The most common cause for it is AIDS. And the fourth type is diarrhea with severe malnutrition. So diarrhea with severe malnutrition occurs usually in malnourished cases like marasmus and kwashiorkor. So acute watery diarrhea, what is the main complication? Is the dehydration with the weight loss. Okay, and acute bloody diarrhea, it usually occurs like all the 3 things. Rest of the 4 things have diarrhea. That is because of diarrhea, dehydration will be there. In addition to that, mucosal damage will be there in acute bloody diarrhea. Okay, that is intestinal mucosa will be damaged. Okay, and there will be malnutrition, sepsis, those things in acute diarrhea. Bloody diarrhea. In persistent diarrhea, what will be there is, since AIDS is a systemic inflammatory disease, so severe non-intestinal infections will be there. Okay, in persistent diarrhea. And in diarrhea with severe malnutrition, there will be heart failure, vitamin and mineral deficiencies, and so many things. Okay, this is the underlying pathogenesis for the 4 types of diarrhea. So it is eighth leading cause of death. Uh, second. So it is eighth leading cause of death among all ages pertaining to diarrhea. So it contributes to about 1.6 million deaths. That is 4.5 billion cases. Okay, it is according to the UNICEF data, UNICEF 2018, and it is a fifth leading cause of death among under 5 children. That is 0.45 million deaths and 1.2 billion cases per year. And it accounts for 9 million hospitalizations. Okay. And loss of 62 million DALIs. What is DALI? The DALI is nothing but it is a measure of overall disease burden expressed as YLL plus YLD. What is YLL? YLL is the years of life lost, okay, due to premature mortality, right? Because of that disease burden, the person will be having disability, and because of that, they will be dying, right? So that will be years of life lost. due to premature mortality, and years lived with disability. For example, if a person is meeting with an RTA and is living with the disability for 20 years, and actually his life expectancy is 70 years. Around the age of 50, at the age of around 40, he is meeting with the accident and is living with the disability for 10 years, and at the age of 50 is dying. Means to calculate tally YLL plus YLD, so years of life lost. Okay, for example, his expected life expectancy is 70 years, but he has lived only up to 50 years. So that 20 years is that YLL plus YLD. So years lost to disability. Okay, so 10 years is living with the disability. Okay, so 20 plus 7, so 30 is the DALI. So the diarrhea accounted for 62 million DALIs. Is what estimated by the UNICEF. Okay. So it is a leading cause of under 5 deaths. As we saw in the previous slide, it is the fifth leading cause of deaths among under 5 children. So these are the worldwide and India-wide cause of under 5 deaths. So if you see the under 5 deaths in world, it is the fifth leading cause of death. Whereas in India, it is the fourth leading cause of death. Okay. In India, the first cause is preterm. Okay? And the fourth leading is diarrhea. So for the world, the data is obtained from UNICEF, okay, 2018 diarrheal disease data, and for India, it is obtained from NHP, that is National Health Profile, okay, 2018. So coming to the burden of the disease, so diarrheal disease constitutes about 9.2% of all under 5 deaths. That is around 1/10 of the under 5 deaths in India is contributed by diarrhea. Okay, and it is as we saw in the previous slide, it is a fourth leading cause of death in under 5 children. Okay, and it is a overall diarrheal disease burden in India. So as per the NHP 2018 data, so this is the disease burden. So in India, if we see it accounted for about 12.9 million cases, and in Puducherry around it is near to 1 lakh, that is 94,360 cases. And deaths, if we see in India, it is 1,331, and whereas in Puducherry, 7 deaths, and death rate per lakh is it is 10.3, and if you take Puducherry itself, it is 7%. So moving on to the next slide. Okay, coming to the epidemiological triad for diarrhea. So epidemiological triad means agent factors, host factors, and environmental factors. What is the modified now with the recent advancement in this epidemiological triad is they have added time component to this. Okay, in the middle, time component will be coming. That is the recent advance in epidemiological triad. And the agent factors, so what are the causes for diarrhea is bacterial, viral, parasitic, and other causes. Okay, so in the bacterial, viral, parasitic, we will be seeing what are the bacteria, or the virus, or the parasites causing. So bacteria, the most common cause is Vibrio cholera, and the Campylobacter jejuni, then E. coli, the E. coli enterotoxigenic E. coli, and Shigella, Salmonella, and Clostridium perfringens, and Staphylococcus aureus. So in the bracket, it is the percentage of cases. So the more common is Shigella, Salmonella, and Vibrio cholera. Okay. Viral causes, the most common is rotavirus, norovirus, sapovirus, enterovirus, adenovirus, astrovirus. Okay. So why Vibrio cholera, Shigella, and Salmonella are highlighted is because these are the most common viral causes which lead to complications. Okay, sudden dehydration complications. That is why it is highlighted. Okay. Parasites, it is Entamoeba histolytica, Giardia intestinalis, Leptosporidium, intestinal worms, Cyclospora. Okay. Though entamoeba stereotica is common in an Indian setting, the most common causes ankylostomia duodenale and Negerter americans. Hookworm infestations most commonly cause diarrhea. Okay. The others are inborn errors of metabolism and irritable bowel syndrome and also antibiotics, irrational use of antibiotics. Okay. That is more common in our setting. So coming to the agent factors, so Vibrio cholerae, as we discussed earlier, it is the most common thing. There are two things, strains, classical or the LTOR strain and the O139 strain. Okay, under international health regulations 1969, it is a notifiable disease. Okay, and the definition for cholera is sudden onset profuse, dry watery stools in diarrhea, vomiting, rapid dehydration, muscle cramps, and anuria. These are the most common things here. The classical thing is dry water stools, and it often leads to dehydration. So the case fatality rate, if we see, is it is nearly more than one fourth, that is 30 to 40%. Okay, and in 2017, there are 494 cases and 3 deaths in India due to cholera. Okay, so for cholera, there is a vaccine. So I would like to mention it here itself, the Diarrhoea vaccine. Okay, so 2 years is the duration between one vaccine and the other, and next is rotavirus. Rotavirus is a viral, common viral cause of acute diarrhea in infants, and it is a leading cause of diarrheal mortality among all age groups, and it is highly infectious. So the toxigenic factors NSP4 enterotoxin. Here the most common pathogenesis is dehydration metabolic acidosis. Okay, so Salmonella typhi, so most commonly causes enteric fever. So it is endemic in India. So MDR strains of Salmonella typhi are emerging, which is the most common public health problem. Here the diarrhea is classically described as peaceful diarrhea and step bladder pattern fever and related bradycardia and shock. Okay, so here diagnosis by Vidal and okay. Culture is the gold standard, and the case fatality rate for typhoid fever is 1 to 4%. And here for typhoid, the socioeconomic impact is huge. Okay, because the typhoid survivors most commonly um, become carriers. Okay, and to recover from that infection, it usually takes several months. Okay, and resume back to work. That is why their income is much reduced. So the socioeconomic impact of the disease is more. And if the fatality rate, if we see less than 4 years, if it occurs in children, means it is 10 times higher, okay, higher chance of having mortality. And untreated cases, it is 10 to 20%. They are the most common cause of death is mainly hemorrhage, okay, shock. So this is the in 2019 the enteric fever cases and outbreaks in India. If we see more than 28,263 cases, that is a brown color. The brown color cases means here if we see UP as the majority number of cases. Okay, so if we take Tamil Nadu comes under 1,779 to 4,572 cases. Okay, so cases reported through surveillance. So the next common bacterial cause we discussed was Shigella. Okay, so Shigella most commonly causes dysentery. That is, we saw great acute bloody diarrhea. So Shigella is the most common. So two types are there: Shigella dysentery, Shigella soni. So mortality rate is more because here the mucosal damage is there, because of the blood loss is there. That is why mortality rate is more. So it accounts for about 1 million deaths every year in under 5 children in developing countries like India. Okay, in a multi-centric studies based upon 6 Asian countries, there were around 845 patients of Shigella. Okay, and whereas no deaths were recorded. Okay, and it accounts for about 164.7 million episodes. It is not cases; it is the episodes of bloody diarrhea worldwide. Okay, and 69% of episodes occur in younger children. Okay. So parasitic causes we saw most common was entamoeba histolytica. Entamoeba histolytica exists in two forms, the trophozoite and the cystiform. The cystiform is the infector. Okay, it causes amoebiasis. So it not only affects the intestine, it also affects extraintestinal organs like liver, lungs, spleen, brain, and invasive amoebiasis. The accounts for 50,000 deaths globally. It affects about 15 percentage of the Indian population. So usually the symptoms range from mild abdominal discomfort to acute fulminating dysentery. So the first factors, the epidemiological diet, first we saw about the agent factors. Next we are going to see about the host factors. So host factors, it commonly occurs in children, that is 6 to 24 months, especially in the weaning period. Okay, and it is highest in the 6 to 11 months, as I told, because that is a period when the transition from the breast milk to the complementary feeding starts. That is why diarrhea is more common, because the GI system is not well developed to adapt for a change. So some children find it difficult to adapt to the change, and that is when diarrhea occurs. And diarrhea and malnutrition are always coincide. That is a vicious circle. Okay, diarrhea often leads to malnutrition. Malnutrition often leads to diarrhea. The mechanism is in diarrhea, what will happen? The all the nutrients or the vitamins, minerals, everything will the food will be lost in the form of diarrhea. Okay, so and dehydration also will occur. So what will happen without absorption of nutrition, nutrients, malnutrition will occur. In malnutrition, what will happen? There will be mucosal damage, okay, and systemic inflammation. Okay, because of mucosal damage, what will happen? When the food particles reach due to eroded surface and mucosal damage, that will cause diarrhea. What are the contributing factors? Poverty, prematurity, reduced gastric acidity, immunodeficiency, lack of hygiene, incorrect feeding practices. So poverty. So why poverty? In poverty means they are not able to take the required RDA, okay, recommended dietary allowance. That is why diarrhea occurs. Then prematurity. Prematurity occurs in premature children. The gut is not mature enough to digest or to absorb the nutrients. So diarrhea occurs. And reduce gastric acidity. If the gastric acidity is reduced, then the infective materials like the bacteria, viruses, those get activated and they cause the infection. Okay, and immunodeficiency. In immunodeficiency also the same mechanism. And lack of hygiene. Lack of hygiene, because of lack of hygiene, there is high chance of contamination with the of food particles with the infective material, and then diarrhea occurs. Then incorrect feeding practices. Then host factors. So the human reservoir, host is mainly the human. So these are the most common causes as we discussed. So animal reservoir, human and animal species. Okay. So infective materials, if we take human species or the animal species. Okay. So mainly parasites and the food particles contaminated with the parasite animal species are the source for diarrhea. So human reservoirs for E. coli, Shigella, cholera, Entamoeba sterilithica, Giardia, intestinalis, everywhere. Humans are the reservoirs. Salmonella alone, animal reservoir. Why means uncooked meat or uncooked meat is the most common thing. The improperly stored meat, that is the most common cause for salmonella. So environmental factors, the seasonal patterns. If we see, most common seasons are mainly in the temperate climate. Okay, that is bacterial diarrhea most commonly occurs in the warmer season, and the viral diarrhea usually occurs in the winter season. Whereas in the tropical climate, viral diarrhea occurs throughout the year, and bacterial diarrhea occurs in the warmer and rainy season. If we take yeah, Puducherry, it is temperate climate, so bacterial diarrhea occurs most commonly in the summer months, that is March, April, May. The bacteria numbers will be more, whereas viral diarrhea will be common in the winter. Okay. So this is the sanitation barrier is what stated. Okay, so the most common cause for diarrhea is fecal-oral route. So as we saw, feces is the most common infective material. So it will contaminate the fluid, fields, and flies which sit on these species becomes infected, and they become the carrier of the infection, and the fingers. So all these 4F become contaminated with the feces, and when they come in contact with the food, they cause the infection. Okay, from one individual to another, how the infection spreads is the thing. And the sanitation barrier means if we are having proper sanitation practices at this level, we can prevent the further infection. That is why here, if we draw a line, that will be coming under sanitation barrier. So STG and the diarrheal diseases, coming to the health programs for diarrhea. So STG goals target 3.2 by 2030 reduce the under 5 mortality to 25 per thousand live births, and target 3.9 is by 2030 reduce mortality due to air, water and soil pollution, and indicator 3.9.2 is mortality rate attributed to unsafe wash services. So these are the things which in STG pertaining to diarrhea. So the target 3.2, 3.9, indicator 3.9. Okay. Okay. And also not only that, so target 6.1 by 2020, access to safe managed drinking water source. Indicator 6.1.1, proportion of the population using safely managed drinking water services. Target 6.2 by 2030, achieve access to adequate and equitable sanitation and hygiene for all. And indicator 6.2.1, proportion of the population using safely managed sanitation services, including hand washing facility with soap and water. Okay. So coming to India, there is a program called NDDCP, National Diarrheal Disease Control Program, which was brought in 1981. Reduction of mortality through introduction of oral rehydration therapy. Okay, so the objectives of this program are reduce diarrheal associated mortality in under 5 children by 30% by 1995 and 70% by 2000, and reducing the case fatality rate to less than 1% and improvement in the water and sanitation facilities. Okay. So this program was brought in 1981. Then there were so many modifications in this program. So National Oral Rehydration Therapy Program, NOP program. Then in 1992 to 1993, NOP program became a part of CSSM. CSSM is nothing but Child Survival and Safe Motherhood Program. So that will come under IMNCA. So CSSM program became part of RCH program. Policy of IMCA adopted, that is Integrated Management of Childhood Illness. Okay. In 2003, it was renamed as Integrated Management of Neonatal and Childhood Illness. Okay. In 2013, it was again changed as RMNCH plus A, that is Reproductive Maternal Neonatal Child Health plus Adolescent. Okay. So it in 2013 it comes under NHM, that is National Health Mission. Okay. So in this IMNCA, there are so many things like ensuring standard case management and appropriate SOPs to be followed, maternal knowledge on home management, like that is improving the mother's knowledge on the home management and recognition of danger signs of diarrhea, increasing the availability of ORS by providing it free of cost, and increasing the accessibility to services pertaining to diarrhea, and monitoring hospital-based diarrhea on the ORS use rate and the case fatality rate, and promoting exclusive breastfeeding for 6 years and proper weaning and infant immunization. Okay, including measles and vitamin A. So these are the things which comes under the RMNCHA. Okay, and so if we see IMNCA, there are three things: pink, yellow, and green. Pink is for child referral, that is immediate thing, inpatient care, needs inpatient care. Yellow is for like child needs specific treatment at home treatment, antibiotic and ORS. And green is child needs no medicine, give home care. Okay. So if the dehydration is present, it is pink. Okay. If the dehydration is absent but diarrhea is present, it is yellow. Okay. So some 2 or 3 episodes of loose stools without dehydration, then home-based care. And also danger signs. If the danger signs are present, it is pink. Okay. Sunken eyes, and tongue is dry. If the child drinks, he not able to drink at all. If it is lethargic, and if the anterior fontanelle, if it is like not bulging, then skin pinch goes back slowly. There are so many things for danger signs for dehydration. And control of diarrhea. So good sanitation and hygiene, exclusive feeding for 6 months, improving the water quality, vitamin A supplementation, vaccine, low osmolarity ORS, zinc, and continuous feeding. So vitamin A supplementation alone reduces mortality from 19% to 54%. So coming to the vaccines, so for rotavirus is the most common viral cause. So for that, rotavac vaccine is given in the immunization. It is brought to the national immunization schedule also. It is given at 6, 10, and 14 weeks. It is given in a 2.5 ml syringe. Okay, and it is a oral vaccine. Second is measles vaccine at 9 to 12 months and 16 to 24 months. Second thing. Okay, and others is cholera. Called for cholera, Dicoral vaccine. Then Sanpol. Dicoral is the most common, and 2 doses 7 days apart. And for if the child is more than 6 years, then 3 doses. Okay, booster 6 monthly once. Typhoid VA polysaccharide vaccine and typhoid 21A vaccine. So 7-point action plan for comprehensive diarrheal control by UNICEF and WHO. So these are the things. First is a fluid replacement. Second is zinc treatment. Then coverage of rotavirus and measles vaccine. Promotion of early and exclusive breastfeeding and vitamin A supplementation. Promoting and washing with soap. Then improving the water supply, including treatment and safe storage of household water, and promoting community-wide sanitation. So as per NFHS 4 report, so these are the percentage of children aged under 5 with diarrhea in the last 2 weeks before the survey. Okay, so that children who sought advice was 68% sought advice, and fluid from ORS only 50% took the ORS fluid. Okay, so ORS and zinc combined only 15% are taking. This indicator showing it is very much poor. And antibiotics 19% were taking. Okay, so these are the most important indicators. And if we see no treatment, 18% did not take any treatment. So as per NFHS 4, this is the red color denotes Puducherry and blue color denotes India. So this is A, B, C, D. So first one is prevalence of diarrhea among children in the last 2 weeks. Okay. So for India, it is 9%, whereas in Puducherry it is 7%. And children who received ORS for that diarrhea. So in India it is 60%, whereas Puducherry it is much higher. And children who receive zinc, so India it was very low, just 1/5, 20%, whereas Puducherry if we see it is around 3/4. Okay. And children with diarrhea who were taken to health facility, that indicators quite okay, because around 2/3 at the Puducherry and India level, they sought a healthcare provider for treatment. So this is GAPPD, Global Action Plan for Prevention and Control of Pneumonia and Diarrhea. So goals for 2025 is reducing the under 5 mortality to less than 1 per 1,000 live births, reducing the incidence of severe diarrhea by 25%, 75%, and reducing by 40% the global number of stunted under 5 children. So the targets are 90% full dose coverage of the relevant vaccines, that is most commonly vitamin A, measles, and rotavirus, and 90% access to diarrhea case management, and 50% coverage of exclusive breastfeeding for first 6 months of life, and virtual elimination of pediatric HIV. So targets for 2030 are universal access to safe wash practices, washes, water, sanitation, hygiene. So what are the targets under this PC? So protect, prevent, treat. Okay. So under mainly this is for reducing the morbidity and mortality due to pneumonia and diarrhea. So protect children by establishing good healthy practices, that is vitamin A supplementation, exclusive breastfeeding for 6 months, adequate complementary feeding, and preventing children from becoming ill due to pneumonia and diarrhea. So hand washing with soap, safe wash practices, vaccines, measles, pertussis, HIV, H influenza type B, PCV, and rotavirus, reducing household air pollution, HIV prevention, co-trimoxazole prophylaxis for HIV infected and exposed children, and treat children who are ill from pneumonia and diarrhea. So for that we will be definitely having ORS, zinc, antibiotics, continue feeding, that is including breastfeeding, case management at the health facility, and improved case taking and referral. Okay, these are the approaches under GAPPD, the cohesive approach under GAPPD. And intensified diarrheal control fortnight. So under this, ORS packets are being distributed. Okay, so the goal of this fortnight is zero childhood deaths due to diarrhea. It was launched in 2014. In 2019, IDCF was held between 28th May to 8th June. That is for that 1 week. House to house search for diarrheal cases will be happening, and ORS and zinc distribution will be occurring. Okay, so mainly the objective is to improve the ORS and zinc use and complementary awareness activities for management of diarrhea. That is home-based therapies, what are available, those things they will be educating to the mothers. Okay, activities in IDCF in 2019. Okay, so at the community level, distribution of ORS to the households and demonstration of preparation of ORS and zinc, and IEC activities, infection prevention and control activities by the ANM on diarrhea prevention and management. During village health and nutrition days, hand washing demonstration in schools, outreach sessions, village health nutrition days, and Anganwadi centers, mobile health teams for urban areas and hard to reach terrains for intensified diarrhea control activities. So at the facility level, what they will do is establishment of ORS and zinc corners for treatment of diarrhea, promoting standard case management practices. That is, SOP will be developed and protocols will be followed for diarrhea case management, and cleaning of water tanks and health facilities. So as per IDSP 2018 data, there were 338 outbreaks of acute diarrheal diseases in Pondicherry and 175 outbreaks of ADD reported in 2019 till April. Okay. So acute diarrheal, according to ADD, what definition? It is nothing but passage of 3 or more stools, which is watery. Okay, with or without vomiting. Okay. So endemic fever, the presumptive case definition is the acute illness characterized by persistent high fever with any of the following like headache, nausea, loss of appetite, toxic flu, constipation or sometimes diarrhea, ectospleen. Okay, and confirmed cases are case compatible with the clinical description of typhoid fever with confirmed culture positive. So gold standard. Okay, confirmed cholera cases, culture positive. Okay, with having diarrhea and culture positive or PCR positive. Okay, that is for cholera. So this we already saw. Sorry, this is ADD outbreaks. That time we saw about salmonella. So if we see the ADD. So ADD, the most common is like majority cases. West Bengal is having the most number of cases. That is 2 lakh cases. Okay, ADD cases. Okay, and if we see Tamil Nadu, it is coming around 70,000 to 1 lakh cases. Okay, so these states are also having higher number of cases. Rajasthan, UP. Disease-wise number of outbreaks reported under IDSP during 2015 to 19. So acute diarrheal disease is the contributes to so many cases, outbreaks during the year 2015 to 19. The major thing is contributed by diarrheal diseases. Food poisoning is the next one. Okay. So Swachh Bharat Mission, which was launched in 2nd October 2014. The aim is for universal use of safe sanitation facilities. So under Swachh Bharat Mission, Gramin Award 3 lakh it averted more than 3 lakhs diarrheal deaths between 2014 to 2019. Okay, so this mission is was planned to avoid more than 14 million deaths. Okay, due to diarrhea and protein energy malnutrition. And under this Swachh Bharat mission, more than 9.5 crore toilets were built across India, and 5.65 lakh villages declared as open defecation free. Okay. So before October 2014, that is before the launch of Swachh Bharat mission, the estimated number of cases were 199 million cases of diarrhea. Okay, so it has been gradually reducing and will gradually reduce. So in 14th June 2019, 30 states or union territories are 100% covered with individual household electrics. So the final thing is Gobi FFF, that is um, this is mainly for diarrhea. So under this growth monitoring, oral rehydration therapy. So O stands for oral rehydration therapy. B stands for breastfeeding. I stands for immunization. F, the triple F, the first F stands for feeding practices. Then this is mainly to improve the breastfeeding, immunization, and growth monitoring of children. Thank you.